Okay, howdy everyone. So this is actually going to be microbial diseases of the digestive tract. For my CCP students, this is chapter 25. For my Camden County students, this is either chapter 21 or 22 in Cohen. I believe it's chapter 22. Okay, but it's infections of the digestive tract. So your digestive tract is going to consist of the oral cavity, your GI tract, which starts at the oral cavity and goes all the way down the esophagus, the stomach, the small, and then the large intestines, all the way through the anal rectal exit there. It is one continuous tube, essentially. And throughout the entire GI tract, you will have microbiome present, including the stomach, which we'll talk about. Then you have various accessory structures, which will include the liver, pancreas, gallbladder, which are considered sterile sites. And you should not have any microbiome present in those areas. So just looking at your microbiome or your normal flora, just some little numbers here. You have millions of bacteria per mil of saliva. The mouth, pharynx, and esophagus will be lined with various types of organisms. The stomach, because of the conditions of having very high acidic content and a pH that can be as low as 0 to 2, you do have very few residents that will live in the stomach. The small and large intestines, the large intestines alone can harbor as much as 100 trillion bacteria, which is interesting because you're only made up of about 10 to 15 trillion human cells. And it is estimated that about 60% of the dry weight of feces is actually caused by bacteria. Now, your defense mechanisms, your primary defense mechanisms for things that you ingest is going to be your stomach and that stomach acid. Many bacteria are not going to be able to withstand that. You also have Paneth cells and immune system surveillance. This is all part of something you may have learned in anatomy, which is called MALT, which stands for mucosa-associated lymphoid tissue. And this is essentially a scattered immune presence along the entire GI tract. Now, here you can see, this would be the surface or the lumen of the GI tract, where you do have lots of luminal bacteria present. And here you can see on the other side of the lining of the tract here, the epithelial lining, you do have these roaming white blood cells here, okay? This is really just to, they're there to survey the area. They're there to keep an eye out for anything that might be sort of trying to encroach through that barrier. All right, so let's start in the mouth. Some diseases. This is going to be primarily decay, tooth decay. It could also be gingivitis, which we'll get to in a second. But tooth decay is not something that happens overnight. This is a progressive process where you start to see erosion of the enamel, pretty much due to biofilm formation on the surface of the tooth, bacteria being present there, and then eventually the bacteria eroding that enamel. This isn't just any bacteria. The bacteria that tends to cause these things called cavities, which is erosion. Here you can see some cavities, in case you never knew what they actually look like. This is actually going to be caused by a bacteria called Streptococcus mutans. And particularly that bacteria for cavities, because that bacteria actually releases digestive enzymes that allow the enamel to be broken down. You also can end up with plaque buildup. Now, plaque is just a fancy word for biofilm, where you have, food buildup, other particles, but also you have bacteria that get trapped in there. You can also end up with this plaque buildup along the gum line. This is referred to as gingivitis. It's oftentimes irritated and red, and in some severe cases can actually lead to bleeding. Periodontitis is when you actually start to see erosion of the gum line. And the species that are primarily concerned with gingivitis and or periodontitis is going to be Prevotella and Porphyromonas species. They'll be on that slide that the strep mutans was on. But here you can see a pretty bad case of periodontal disease. So how do we prevent these issues from occurring? Brushing your teeth, everything that we've been taught from a very early age, flossing, mouthwash, fluoride. Fluoride is typically placed into the municipal water supply systems. So if you have water that you get from a municipality, such as the city of Philadelphia, fluoride is being put into the drinking water. And the reason why fluoride is important is because it does harden the enamel of the teeth, but not only that, but it also hardens your bones. So cavities or dental caries, these are caused by strep mutans. This is a gram-positive rod, and it does secrete those digestive enzymes that allow you to break down the enamel of the tooth. Periodontal and gingivitis, these are caused by Porphyromonas and Prevotella species. Now moving down a little lower into the GI tract from the mouth, a little further down, we're going to talk about diseases of the lower digestive tract. And this is really going to be pretty much 100 ways to either get diarrhea or to vomit. Not 100 as a literal number, but it's going to seem like that. You're going to see that the very common treatment for most of these is just to stay hydrated and let it run its course. The most common cause of diarrhea in the United States is caused by norovirus, which is something that will just pass usually within 24-48 hours. But a lot of the food intoxications or infections, these just need to pass. You're going to lose fluids. You need to maintain those fluids, electrolytes. And depending on how severe some of these infections are, you might actually also need some antibiotic help there. Now, I want to differentiate between two things, an infection and an intoxication. An infection is an actual growth of a pathogen causing issues for you. That's not going to happen immediately after you eat something. That is actually going to take about 12 hours to upwards of 2 weeks. And you'll also oftentimes see a fever associated with that. Intoxication, this is when you actually ingest a toxin that could very well have been produced by a bacteria. This is a very common cause of food poisoning, especially for staph. Staph is something that we find on our hands. And if you are preparing food and you handle that food and you transfer that staph to the food, which is now kept at undesirable temperatures, at room temperature or warm temperature, that staph can grow and produce toxin, which could also end up on the food, and that can initiate a reaction once ingested. Usually symptoms of an intoxication appear within the first 24 hours and can be upwards of 48 hours. Gastroenteritis is diarrhea or dysentery. Dysentery is bloody mucousy diarrhea. Treatment for most of these diseases, as I mentioned, will be oral rehydration therapy. Not only do you need to replace the fluids, but you also need to replace the electrolytes that are being lost. So in case you didn't realize, somebody actually classified stool, and we actually have 7 types of stool. And this is the Bristol stool chart. They are actually looking at expanding this, by the way. But type 6 and type 7 are considered diarrhea. Okay, you guys can use your imagination to visualize these. There's 3 types of varieties. We have acute watery diarrhea. This lasts several hours or days, and it includes something we'll talk about in a few minutes, cholera. You have acute bloody diarrhea. This is also called dysentery. This is where you have blood in the diarrhea, but also it could be very mucousy. A persistent diarrheal infection is anything that can last upwards of 14 days. So diarrheal diseases, these are the second leading cause of death in children under the age of 5. It does kill about 1.5 million children per year. And there are over 2 billion cases per year worldwide of diarrheal cases. The big thing that leads to death in especially in the children, is dehydration and electrolyte imbalance. A lot of times they may have contracted these diarrheal diseases due to contaminated water. And if they are using the same contaminated water to replenish the fluids, that's just sort of counteracting the whole effects. Access to clean water and diarrheal diseases are directly related. This is a correlation where you can see up top, populations without access to safe drinking water. The darker the red, the less likely there's safe drinking water. And below is deaths per 100,000 in children due to diarrheal diseases. And you can see that these two maps pretty much overlay each other almost directly. So staph food poisoning, this is the most common food poisoning in the US. It's caused by Staphylococcus aureus, which is a very common organism that we find on the skin of everybody. Symptoms of staph food poisoning include nausea, vomiting, and diarrhea. This does result in intoxication. The staph has produced a toxin that is triggering this, and there is no treatment. The treatment is just to let it run its course and to replenish those fluids. This is, how food poisoning can arise. I just pretty much gave you an example earlier on where you handle a piece of, say, chicken, you leave it at room temperature, bacteria grows, you eat it, and then you get sick. If you've ever worked in food industry, you know that it is very important that food is either kept above or below certain temperatures. The goal here is to make sure that you are not keeping food at undesirable temperatures. Shigella. Shigella is going to cause a very nasty infection. This is actually a very invasive bacteria that gets into certain cells, and it will actually cause replication inside the cells, and it will cause those cells to splice. And then you also get invasiveness to neighboring cells. So you're essentially forming destruction of the epithelial lining here, which can lead to an abscess. Now, just picture as far as the result is concerned, you're going to have diarrhea, but now you also have tissue destruction, which can lead to bleeding. It can also lead to, inflammation, which can lead to mucus production. And this is essentially going to give you dysentery. So Shigella species will cause upwards of 20 bowel movements per day. Diarrhea is often very bloody, crampy, and you will most likely run a fever. This they will treat with antibiotics as well as oral rehydration. And at 20 bowel movements per day, you're probably hooked up to IV fluids, trying to get as much fluids back into you as possible. As far as Shigella in the United States or Europe or many developing countries, that's not a huge issue. This is really in second and third world countries where access to clean water might be a little problematic. Now, Salmonella, this is something that you might have heard of. This is something that we find on poultry, more specifically chicken. I am sure that everybody is very aware that whenever you handle chicken, you need to be careful. You need to make sure that chicken is cooked properly. And when you were using a cutting board or knife, that you disinfect that cutting board and knife before you use it for anything else, especially things that might end up staying raw and not being cooked. Salmonella is a very common organism that is found on poultry. I'm actually going to come back to typhoid fever in a second, but the salmonella that we typically see in the United States that's found on the poultry is called Salmonella enterica. This will lead to several days of nausea, diarrhea. It will eventually run its course, and you just need to make sure that you are maintaining oral rehydration. Salmonella typhi, this is actually another type of salmonella. This is different than what we typically see on poultry. This causes very high fever, headache, and there's a significant mortality rate. With Salmonella typhi, this is more commonly referred to as typhoid fever. There is no animal reservoir, although we think that humans are actually the reservoir for this. Bacteria will spread throughout the body in phagocytes, and people that have typhoid fever are losing about 5 to 20 liters of liquid stool per day. That is an enormous amount of fluids to be losing. and a lot of times they are not able to reclaim that. As a result, a lot of individuals, they can't survive this, and they unfortunately pass. With typhoid fever, people that do survive this, 1 to 3% of recovered patients will become what they call chronic carriers. Now, the chronic carriers are no longer symptomatic, but just because you're not symptomatic doesn't mean you can't transfer that to other individuals, as we have learned with coronavirus. And there was an individual called Mary Malone, that was her name, or she was given the nickname Typhoid Mary. She was a cook, worked for a very wealthy family in New York City. She had typhoid fever, recovered, but became a chronic carrier. And unfortunately, she passed it along to that family, and several members died. Once they investigated, they realized that she was the source of it, and they told her she can't prepare food or handle food for anyone moving forward. Well, that was her livelihood, so she ended up finding another job with another family and repeated all over again. New York City eventually deemed her a public health risk, and she was placed in quarantine for the rest of her life. And she actually lived in a facility for the remaining years of her life. Okay, cholera. This is caused by Vibrio cholera. This produces a toxin, which will cause the host cell to secrete chloride, bicarbonate ion, and water. So you're losing an enormous amount of fluid. This is what Vibrio cholera looks like. They kind of look like those little elbow macaronis. And what you get with Vibrio cholera is enormous amounts of fluid loss. This is actually the problem that we see in developing countries with children under the age of 5. This is that primary killer in those children, is cholera. Unfortunately, they catch cholera most likely through water, drinking water, and it gives them diarrhea, and they just lose too many fluids. And if they're not brought to a health center where those fluids electrolytes can be replenished, unfortunately, it can lead to death. And as I mentioned at the onset of this lecture, we have about 1.5 million children each year that die from diarrheal diseases. E. coli. Now, E. coli is actually a bacteria that we typically find in our gut. When we talk about the urogenital tract, which is our next lecture, E. coli is a bad guy. But E. coli is generally a good guy in our gut. And if you're going to find E. coli anywhere in your microbiome, it's going to be in your gut. There are, however, several bad E. coli strains. And they're classified into 4 types of families, depending on their overall effect on the body or tissue. And I'm not going to ask you to distinguish between these 4. I just want you to know that there are pathogenic E. coli. There's enteropathogenic E. coli, EPEC, enteroinvasive E. coli, enteroaggregative E. coli, and enterohemorrhagic E. coli. Okay, the entero is referring to the gut. The EC is E. coli, and it's just whether it's pathogenic, invasive, aggregative, or hemorrhagic. This will lead to diarrhea, and it's self-limiting, meaning that it will eventually resolve itself. Once it does resolve itself, you need to just maintain oral rehydration. Campylobacter jejuni. This is primarily going to affect the jejunum, as the name implies. This will cause fever, abdominal pain, diarrhea. It's typically found in chickens and cows. This, like I said, it's going to cause diarrhea. And you got to let it run its course and just make sure that you're replenishing the fluids and electrolytes. The good thing is that the treatment's pretty much consistent for all these infections. For some of you that may have traveled, especially outside the US, there is a phenomenon called traveler's diarrhea. Traveler's diarrhea is what happens is because you, A, live in the United States and are afforded the very strict criteria by the USDA and the FDA, your intestinal tract is actually kind of weak. a lot of other countries do not necessarily have the standards of food care that we have here in the United States. Doesn't mean it's bad. It's just that we're pretty strict here. And unfortunately, when you travel to some of those other countries, your microbiome that makes up that intestinal tract just can't handle what's coming its way. And oftentimes it leads to traveler's diarrhea. Traveler's diarrhea is very commonly caused by the various things that we talked about, with the different types of pathogenic E. coli, Salmonella, Shigella, Campylobacter. The State Department does recommend that if you are traveling outside the U.S., that you tend to stay away from, raw or undercooked meats, fishes, poultry, that they are making sure everything's cooked to temperature, that you use bottled water, especially depending on the country, in order to avoid the potential for something like this. Helicobacter pylori, this is an organism that we typically find within the GI tract. Helicobacter pylori can be normal flora in many adults, especially by the age of 50. Unfortunately, it is an opportunistic pathogen, and if you are under severe stress, mental, physical, physiological stress, that can actually give this guy the opportunity to become more invasive. And when it does become more invasive, it actually erodes away the mucus lining of the stomach, which is very important because it prevents the stomach from eating itself because of the acid. Somebody that has an H. pylori infection is at very high risk of developing an ulcer, and that's usually what results. Helicobacter pylori is the causative agent for peptic ulcers. Diagnosis is urea breath. They'll do a breath test, or culturing, and this is treated with antimicrobial drugs. Yersinia Gastroenteritis. This is going to cause abdominal pain and diarrhea, usually mild. This may be confused with appendicitis. Diagnosis, it could be found by eating milk or meat from various animals. That's why it's very important that, if you're going to be consuming things like raw milk, that you know the sourcing of it. And, if you're drinking regular milk that's from the supermarket that's been pasteurized, you're most likely fine. But like I said, this can cause pretty painful cramping and lead to diarrhea. C. diff. C. diff is probably something that if some of you work in healthcare facilities, especially in nursing homes or long-term care facilities, you're very familiar with C. diff. C. diff is Clostridium difficile. It will cause diarrhea to colitis. The causative agent for C. diff is actually people on antibiotics. And it's also tends to affect older patients, people in those closed facilities. It is very common following a long course of antibiotics. Unfortunately, treatment for C. diff does involve antibiotics. So a lot of times you end up with this cycling going through these C. diff infections. It is very important that a patient that has C. diff, that you are making sure that the patient is isolated. Anybody that enters or exits the room is taking special precautions. Usually you have to wear a hairnet, gown, and booties on your shoes. And this is just to make sure that you don't transfer the C. diff to other patients. The more common thing that's becoming for treatment of difficult cases of C. diff is what we refer to as a fecal transplant. This is where they take fecal material from a patient and they transplant it into a donor. They take fecal material from a donor, usually from your household, and transplant that into a patient that has C. diff. And essentially what a fecal transplant is you're putting in trillions of bacteria, good bacteria, that will combat the C. diff. C. diff is very difficult to handle in facilities. You cannot use normal disinfectants. Clostridium is a species that is a spore-forming bacteria, and you need to treat it as such. Coming out of FDA approval is what they are dubbing quote-unquote poop pills. They have found a way to take fecal material and encapsulate it so that you don't have to go through the full endoscopy procedure. You can just swallow a handful of pills to replenish that. Mumps. The mumps virus will cause swollen parotid glands. The incubation period is 16 to 18 days, and this is something that is prevented by a vaccine. And here you can see this poor kid has very swollen parotid glands. Hepatitis. Hepatitis is actually a disease of the liver. It's inflammation of the liver. Hepatitis can result from chemical toxicity, meaning overuse of drugs, both prescription and non-prescription or recreational. Epstein-Barr virus or cytomegalovirus, or the hepatitis viruses. Here's a healthy liver. Okay, it should be nice and squishy and plump and red. Here's a cirrhotic liver. This would actually feel as hard as a rock. And this is not a functional liver. And unfortunately, if you are end-stage cirrhosis, that could actually lead to death. Hepatitis, there are 5 hepatitis viruses, A, B, C, D, and E. All children are vaccinated now against Hep A and Hep B, which provides protection against D and E. You will most likely need boosters of Hep A and B throughout your life. There is no vaccine for Hep C. There is a treatment for Hep C, but it is extremely expensive and usually only done as a last resort. Okay, as I mentioned, norovirus is a very common cause in the United States of diarrhea. This is what we refer to as the 24-48-hour bug. Rotavirus is also one of those viruses. There's no treatment for this. You just got to, chug the Gatorade and, keep the fluids up. Okay, some parasitic infections. Giardia. Giardia is a protozoan that adheres to the intestinal wall, and this leads to diarrhea as well. Treatment for this is by an anti-parasitic drug referred to as metronidazole. You will be in the hospital with this. This is going to require IV fluid replenishment as well as IV antibiotic treatments. This is something that you would acquire by drinking, say, open water sources. So if you're an outdoorsy person, you really shouldn't drink water from just an open stream or an open water source. Cryptosporidium, this is also found in cattle and water, and this can actually cause a self-limiting diarrhea, which means it will resolve itself, but in immune-compromised individuals, this could actually lead to death. And then amoebic dysentery, this is another parasite that will cause abscessing of the intestinal wall. It is quite invasive, and there's actually a significant mortality rate with this because of its invasiveness. This needs to be treated, within a hospital and needs to be dealt with very serious. It's a very serious infection. Okay, and that is it for this chapter. The next few slides go over worms. I just threw that in there for your own knowledge. If you do want to get grossed out, continue. If you don't want to get grossed out, you may not want to look at them. But I'll leave you with this. 1/3 of the world's population actually does have a worm living inside of them. And if you want to explore that a little further, like I said, look at the rest of the slides. But as far as the exam is concerned of what I will be asking, this is where we stop. Okay? Enjoy the rest of your day, guys. Have a good one.